Hello, everybody. Welcome to our third or fourth installment, I think, of the Finish 2024 Strong webinar series. I am your host, Heather Haro. I'm so happy to be here and, really getting the opportunity to share products, services, awesome things that Lisa and I come across that we think would be, number one, profitable in your pharmacies. Number two, things that you can proudly and confidently promote to your folks as well. So today I have our guest, Sarah Ford, which Sarah has been having to deal with me for the last 4 weeks, bothering and emailing her because you guys are so fantastic. I sent out a marketing email for this and we already have people that want to become customers. So we love that. We absolutely love our crew for that. So Sarah, take it away.
Okay.
I am going to share the screen here, Sarah, and then we can kind of roll.
And Heather, you've not been trouble at all. I have more trouble in my life. So I appreciate you inviting us and connecting with me and all that.
So I trust everybody can see the PowerPoint deck there. Okay. So I'll kind of start it off and then turn it over to Sarah here. But again, our company is OP2 Labs. Like I said, we're a clinical nutrition company, and we've got two brand lines we're going to be sharing with you today. Historically, the ProTGold line has been that clinical go-to product. It is available at retail as well now. And then the sports nutrition product line that I was talking about is Frog Fuel. And just kind of the backstory on that, two of our founding executives are former Navy SEALs. So, they're known as frogmen. So our sports performance product, we followed that same kind of moniker and made Frog Fuel. So that's the tie-in to the name there.
I love it.
So here is kind of a visual of the two product lines that we'll be talking about today. And we'll get into them in depth. Now, one thing we like to do, webinars are tough, so we do want to give some time for Q&A. We'll get some allotted time at the end, so that way we can kind of get through all the pertinent information. So if you can jot down your questions, if you have any, we'll definitely allot some time at the end. So really just the quick 10,000-foot view of our agenda today. I've already introduced who we are. We're going to be talking kind of generally about, nano hydrolyzed collagen protein. I think most on the call have heard of hydrolyzed, and we're going to tell you the difference and why we stand apart with our patented nano hydrolyzed collagen. And then we're going to talk a little bit more in depth about the product lines themselves. We will also at the end discuss why you would want to bring these products in, both from a benefit and outcome type of a scenario, but then also dive into some of the business metrics that we bring to the table as well. And then during that time, obviously, we'll go through pricing as well. So real quick, we are that leading manufacturer and distributor of high quality US made collagen protein supplements. We do specialize in collagen. For those that don't know or are not aware, collagen is probably the most abundant property next to water in our bodies. So it's a natural protein that our body is used to assimilating. But our products they're used extensively in the medical industry and by professional athletes alike. As I said, we've got two brand lines, the Frog Fuel and the ProTGold. They are superior. They provide superior results in the healthcare and from a recovery aspect in the athletic endeavors. Really, this is a product that hits on just about every demographic from a quality of life standpoint, and for those individuals that are looking to lead a healthier and more active lifestyle too. So again, we'll be diving a little deeper on that, but we definitely, along with the medical benefits of the products, we definitely have a very high quality of life benefit as well. So So just real quick, I know we've already kind of introduced ourselves, but my name's Eric Pollard, Senior VP. I have been in the industry a little over 30 years, mainly on the sales side of things. But one thing I do pride myself in, is the fact that I do identify different revenue streams and really help our strategic partners in maximizing profit. So, when this webinar came along, it definitely spoke to me, because that's something that I pride myself on as well. So,
yeah, you're speaking our language there, Eric.
Awesome. Well, we've got some good stuff that we're excited to share.
Very good.
And then Sarah Ford, again, she's the account executive. She's going to be working with you guys, daily. And she as well, she's got over 16 years of account management experience. She is our top sales rep at this point. She's probably the most knowledgeable that we have on the ProTGold side, and how that relates to not only the true medical applications, but also sourcing that through pharmacies like yourselves. And again, that focus is one, bringing a great product to market that benefits the end user. But more importantly, the reason we're all in business is how do we maximize those profits, and why do my products bring that to the table? So with that, I'm going to turn it over to Sarah, and then I'll come back in at the end, talk a little bit about the frog fuel lineup, and then we'll get into some business metrics. So Sarah, it's all yours.
Yeah. Well, and first, I bet you guys are all wondering how I have 16 years experience when I'm only 29. It's just crazy, just
Collagen.
I take it daily. I do. Honestly. But anyway, yeah. So thank you, Heather, for having us on, and thank you for connecting. And when Heather and I connected, and she was kind of talking about the frog fuel, I kind of brought up the ProTGold, because I do work with a lot of pharmacies that then partner with skilled nursing and rehab facilities or hospitals to then drive their outpatients to the pharmacies. So that's another avenue that I'm familiar with and have done in the past. And it's a great way to get those, people that are being discharged into your pharmacy to then buy ProTGold, because they've already used it in the hospital system. So just FYI for that, and I can discuss, more one-on-one, but just a little bit about collagen. You guys might already know, but it's the most abundant protein in the human body. It makes up about 30% of all protein. It's critical in any kind of connective tissue, such as skin, muscle, bones, tendon, ligaments, blood vessels, intestinal lining. So it's really critical to the body. In its raw form, it's not a complete protein because it doesn't have tryptophan naturally in it. It's also very large in size, so it's not easily digested or absorbed. And so this becomes very important when we start discussing wound care management and repairing the body, or even just maintaining what we have. So over time, the body's natural collagen production declines. And so that leads to common issues such as loss of skin elasticity, joint pain, weakened muscles, slower recovery from injuries. Maybe you guys have dealt with some wrinkles, or, aches and pains. It's just over time, the body doesn't naturally produce it. It produces it, less and less. So collagen is really, really critical for wound healing, skin elasticity, and supporting muscles and joint health. And then next slide. Perfect. So most of you guys have heard of probably hydrolyzed collagen. What we've developed at OP2 Labs is a unique patented collagen called Nano hydrolyzed collagen, and it is unique to OP2 Labs. So it's something that's not out there on the market besides with us. Our collagen is enzymatically broken down into a smaller nano-sized particles, and I'm going to show you a slide with a picture here in a minute. And that allows for faster and more complete absorption compared to other collagen supplements. OP2 Labs Nano Hydrolyzed Collagen Protein is an essential complete protein because it contains all the amino acids and non-essential and conditional essential amino acids, setting it apart from other collagen supplements that only may be partially enhanced or fortified, or sometimes not even enhanced or fortified. It could just be a pure collagen protein. So ours is enhanced and fortified with tryptophan, making it a complete protein and all the amino acid profile. We also are formulated with high arginine content, and arginine is a critical amino acid for tissue repair and wound healing, as well as it has rapid absorption, and it's been proven to perform 100% digestion within 15 minutes. So we know that what is on the label of our product is going into your client, customer, patient, and they're getting everything that's on the label, which is important. ProTGold is highly effective for immediate recovery needs. Next slide.
Sarah, to that point, just really quick. So I had gastric sleeve surgery, I think I'm 9 or 10 weeks, maybe. I don't know. Maybe someone can correct me. Anywho, so I am in lots of groups that have other folks that have had this surgery. I do not have the same issues that so many other folks have. And I truly believe it's one, because I take frog fuel. So I'm not having such a hard time getting my protein in, which is like embedded into your brain. Get your protein, get your protein, get your protein. Because I don't want to be skinnier and then ugly too, right? I don't want to have saggy skin and all that. How terrible is that? But just the internal issues. I haven't had pain. I mean, I don't know for sure, but I'm pretty sure my stomach is healing fantastically just because I don't have so many of the other issues that I see all of these folks in these groups complain about. So I think I would, testify that I believe my stomach has healed so well because I've taken this since, Lisa gave it to me right after my surgery. And I knew nothing about it. She said, you have to take this. It will help you. It was to get my protein in, but I think an awesome side effect is that I've healed fantastically. Like I never even had the surgery. I don't deal with any of the issues that these poor other folks have had. So I could see that working in my own body.
Yes, absolutely. I work with a lot of bariatric clinics, a lot of pre and post surgery. But to your point, and we're going to get to this in a minute, but 1 ounce has 17 grams of protein with a full amino acid profile. You can't get that anywhere. And when you are post bariatric and your little stomach is about that big or smaller, worked in bariatric for about 22 years, so I'm very familiar with the bariatric industry. You just can't. It's just you can't get it in. You just it's physically impossible, right? So we are literally getting more and more involved in bariatric because they see the benefit of ProTGold on my side, Eric with the frog fuel, although, we kind of intermingle a little bit. And you know what? Let me pause for a minute. I forgot to introduce Mike. Mike is the new national sales director. And so he's been on board with us for a little while now, maybe 2-3 weeks, I think. So I apologize about that, Mike. But he'll be working hands on like one-on-one with me on the ProTGold side and the medical sales division. But anyway, yes, to your point, I have just being in bariatric for 25 years and seeing all the side effects, even having my own sister have bariatric 15 years ago and having to get full skin recovery surgery and having ulcers and all the complications that it came with. That's even why I'm more passionate probably about ProTGold and helping people. So I appreciate that testimony, Heather.
Yeah, I think it's such a segment that our pharmacists can really look to serve in their communities. People don't talk about it because it's made shameful. Still, to this day, it's made shameful. It's the easy way out. It's all of these other things. So I think that if you just started speaking to this within your pharmacy and your community, that you would be surprised at the amount of folks that would come out and really be excited to have something that's easy to put in your little stomachs.
Exactly. When I think we're going to get to this, Eric might have a slide, but even everybody on the semaglutide and the tirzepatide, and we'll probably get to this in a minute, but it is critical that they have ProTGold or frog fuel. It's critical because they're not eating enough protein. They're getting muscle wasting. Their stomachs it's a critical product. So I've been doing a lot of like the weight loss, centers and things like that, because that's the only way these patients can get their protein in. So
I love it.
From bariatric to even the GLP-1s, I believe it's called. It'd be an easy sale. I mean, you're filling that prescription, you're taking them right to ProTGold or frog fuel. It's like you have to have it, type of thing. So Okay, cool. So what makes nano hydrolyzed collagen different? Because this is probably something new to most of you guys. It's enzymatically hydrolyzed, meaning it's already been broken down with a fruit enzyme. So we don't use a heating process, which can cause a lot of contamination or different issues. We use a fruit enzyme to break down the product. And so by that being said, our molecule is 150 times smaller than a non-hydrolyzed peptide. And I'll get to why this is important on the slide that has the picture. These molecules can be absorbed directly into the bloodstream without needing to be further broken down by the body. So you're not worried about somebody's digestive tract or how healthy they are, even their age. It's going to be automatically absorbed into their body. We've got complete absorption or digestion within 15 minutes. We have a lot of clinical studies that show that ProTGold and its nanohydrolyzed collagen is 100% digested within 15 minutes, ensuring that the body can use it for immediate repair and recovery or just nutrition. We also see greater plasma levels of glycine and proline, and these amino acids are essential for tissue repair, and the enzymatic hydrolysis increases their bioavailability. So just much more, like I said, what you see in the label, your body's going to get, which is important. This shows you that pretty picture that I was talking about, which everybody's visual, so this will help. Collagen by raw nature is about 300,000 Daltons, and your stomach pores are about 4,000 Daltons. So if you're taking in regular collagen, that's a big molecule for that body to have to break down and digest. So how much is getting absorbed? Not really sure, right? It depends on a lot of factors. Then you've got your whey protein, which whey is a complete protein. It does have tryptophan in it. However, it's also a large Dalton. It's 18,000. So once again, if you've got bariatric surgery, how much of that are you absorbing? I mean, or if you're older or any kind of issues, that's a large Dalton. Not that whey is still important for lots of different things, but our nanohydrolyzed collagen protein is 2,000 Daltons. Now remember, your stomach pores are 4,000 Daltons. So that's how small, if you look at the comparison, the molecule is, and that's why we call it nanohydrolyzed. It's super duper duper small. So 100% absorption within 15 minutes, and easy. It doesn't really have to be digested. So great for anybody from the young to the old.
Yeah,
Love it.
just to add to that, the absorption's actually happening in the stomach. So it's 100% absorbed before it even starts to enter either of the intestinal tract. So again, very, very easy on the GI system for any of those patients or customers that are either compromised by disease, post-surgical, or any other state. So.
Yep. Even going back to those GLP-1s, a lot of times that can cause like stomach paralysis and different things. That's why you get nausea. So this product is great for them because it's 100%. The stomach don't really have to work, if that makes sense. I know that's kind of simple terms, but they're going to get that protein into the system and the amino acids, and that's what's most important. So. Okay, so just kind of talking a little bit lastly about our clinical proven protein. Our nanohydrolyzed collagen protein is backed by a multitude of clinical studies demonstrating its effectiveness in over 20 medical conditions. We've talked about pre and post surgery. There's a lot of other dialysis, clear liquid diets, malnutrition, you name it, we could probably fit to that patient. It's got enhanced wound healing. Studies show that ProTGold helped improve the healing speed of wounds by 2 times in clinical settings. So we have a bunch of wound care clinics, a diabetic ulcer specialist that use our product to help their patients. Bioavailability after ingestion, collagen hydrostates were quickly absorbed into the bloodstream, increasing the plasma levels, like I said, of glycine and proline. Amino acids essential for collagen biosynthesis, so it's very bioavailable. And then, of course, the rapid absorption, which we've been talking about. It's nanohydrolyzed, so it's completely digested within 15 minutes, which significantly outperforms traditional collagen peptides and whey protein. And these studies prove that not only ProTGold can provide complete proteins for faster recovery, but also facilities for faster, more effective wound healing, making it ideal for medical use. And I know I'm talking a lot about wounds, but over 20 medical conditions. So if a person's coming in to get a prescription, they probably need ProTGold and or frog fuel. Let's just be honest.
Add it on.
Unless they're just getting cough medicine or something. I don't know. But, you know, I'd say 95% of your patients could benefit, definitely.
So, all right. Well, we'll roll into some of the product details. So just to, you know, kind of summarize what Sarah has said, you know, we have got a product that, you know, you start talking about revenue streams and profit margins, you know, first, the protein category as a whole, and I'm talking all the whey proteins and all the stuff that you guys probably have on the shelves, you know, one, not trying to disparage anybody's product, but that category as a whole has really been commoditized, right? There's just not a lot of profit margin to begin with.
Right.
You know, most retailers are lucky to get 20 points of margin on a, you know, a big tub of whey. What we have the ability to do, and it, you know, goes off of what Sarah was saying, with 20 different indications, now you have a product that truly is hitting just about every demographic. We like to say male, female, from 8 to 80, right? So, you know, we've got the medical product that again addresses up to, you know, a little over 20 different indications. But then conversely, we've got the frog fuel product. So this is our answer to the sports nutrition need. When, you know, we were looking to launch a sports nutrition product, we felt that there was a gap in the marketplace. You know, let's not even start talking about the margins or any of those metrics yet. The simple fact of the matter is, you know, every whey protein that's out there, I'll be real honest with you, we know for a fact there's about 5 different manufacturers. So out of the hundreds of different labeled products that are out there, you can see they're probably identical with a different label on them. Okay. Not only that, what we run into retail is, you know, if you've got a customer buying a protein product, say brand X, and you have that same type of product sitting right next to it, and they want to try the new brand Z. Well, as a retailer, you know, you're trading dollars, right? You've not increased revenue. You're still sucked into that, you know, sub 20 point margin category. But again, if, you know, you've got multiple brands, you're just trading dollars. With a clinically proven product like both ProTGold and Frog Fuel, now what you can do is actually increase shopping cart value. You can add another product to that whey protein, because Sarah's already gone over it, but all of our products are, you know, not only do we keep saying clinical, but it's targeting that extracellular matrix of the body. So those building blocks, right? Because what you see a lot of times, you see guys that are using, you know, a bunch of protein, and obviously we're segueing into the sports performance type end of things. You know, the medical is a whole different animal. But at the end of the day, if you're putting on this added muscle, but you've not strengthened the building blocks of your body in order to support that added muscle, you can see pretty quickly how injuries happen, right? So now, you know, that guy that's already buying that protein product from you, you now can increase profit margin, because instead of, you know, 20 points, even our lowest tiered wholesale price points, about 30 points of margin. So you're increasing margin, you're increasing shopping cart quantity and shopping cart value. But one other big differentiator is keep in mind, you know, going back to our clinical use of ProTGold, is that product by FDA standards is a medical food. So we're required to, you know, uphold certain quality and control standards, not only from an end product, but also our entire supply chain. Further than that, on the ProTGold side, I can't make any claim, or Sarah can't make any claim, that we can't back up with a study, whether that be clinical, scientific, or otherwise. Now, my frog fuel product, it's the same clinical formulation, but it is a supplement because it's in that sports nutrition category. Now, that supplement category is kind of like the Wild West, and I could get away with it too, but just about every manufacturer out there, touts all these unbelievable claims, and they don't have to back that up with any kind of substantiated study whatsoever. As long as they're listing out ingredients and they're not making somebody sick or worse, killing them, you can pretty much make any claim that you want on a supplement to an extent. We could do that on frog fuel, but as a company, we've taken that same clinical standard from the FDA medical food category, and we've pulled that across all of our brand lines. So really, earlier I said we're the first, if not the only company that's bridged the gap between medical nutrition and sports nutrition. We are that same company that has the only true clinically formulated product that sits in both that, call it adult nutrition and sports nutrition sections of retail. So
yeah, I love this for profit margins, but also as it's such a smart product to be able to raise your level of awesomeness when you are, I know you guys hear me preach about getting your media list and sending out emails to your media contacts, local, community contacts every month. This is a great thing to put in there and to start talking about. It's just another way to shine your awesomeness using a product like this, because it's such a smart product. And it allows you to share your smarts as well. It's fantastic. I love it for those reasons. I don't think that the general public knows even a fraction of this. I mean, I work with Lisa every single day of my life and did not know really that this product existed. One, until I got surgery, and then two, we have, we're building an Olympic in Lisa's son, that I really started to dive in on how fantastic this product is. And so by just sharing that, people will flock to you. It just takes one video to take off, or, one radio appearance to take off. So.
Yeah, and just to back up, so one thing I didn't share, so on the ProTGold side, there is several different form factors. One, we've got, as you can see, the box of 24 individual dose units. It also comes in a larger 30-ounce bottle, and then a kind of a medium-sized 16-ounce bottle. And that's on all of our liquid products. And those liquid products come in a berry flavor and an orange cream. So we are extending and expanding our flavor palette on those products. Now, one other that we have, and it's a powdered product, but I don't want you to think that we brought a powdered product out just to have another powder sitting on your shelf. Everything that we launch is really from that clinical mindset. We're not bringing out products just to take up more shelf space. When we launch a product, it has to have an end use and a specific use for us to bring it out. And that goes without saying. It has to be effective, efficient, and in line with what we've already got out there. So one thing that we discovered is we worked with the elderly demographics, is that in a lot of nursing homes that use our product, and not everybody gets it, but there's a disease that as we get older, some people get it. It's called dysphagia. And that is when a person has trouble swallowing liquids, right? So having a liquid product, obviously, if you can't swallow it, you're not going to have any kind of benefit from it. So we brought out a powdered product in a very general vanilla flavor in order for those situations to be able to use it for solid food mixture. So now you can put a protein in a pudding cup, or a different meal. So something that can be added to a solid substance in order for those elderly people to still be able to consume it.
Yep, love that. I absolutely love that.
And then frog fuel, that is only in the individual dose packs. We don't have those in bottles, because again, this is more catered for that active lifestyle, that person on the go that's moving. Because this packaging is very durable. I mean, I keep them in my golf bag and my gym bag, and literally when you need something, you've got a ready to drink shot of protein, very low volume with a high protein yield. So again, you're not having to chug down one of those big shakes any longer or anything like that.
Yeah, it's not intimidating at all.
Yeah.
I think that's what got me to actually take it in the first place. Was it's just not intimidating, and it goes everywhere. It's easy to pull out. Now that I've had my surgery, when I need to eat this second, not 1 second later. I'm going to eat someone's face off, which is a totally different sensation. But it has helped with that. It has helped with me not being hangry at every person I come in contact with when that happens. So I absolutely love them. I literally was handing them out to friends and pharmacists and exhibitors and anybody who was talking about protein, because protein is a huge topic right now in CPA. And so I probably gave out, I think 12. Like I came home with just 2 in CPA. I shared them with anybody and everybody that was talking about protein.
Yeah, well, that's great because you're absolutely right. I mean, everybody needs protein, so everybody's a target for any of these type of products. But again, the beauty is to your point, it's very easy to take on the go. You're not having to mix a shake, you're not having to drink a big volume. And with that said, the beauty about this product is it sells itself, right? There is such a big quality of life benefit out of it that, well, cut right to the chase. Our churn rate right now is below 5%. So out of 100 people that start taking our product, 5 may drop out. And as we know, there's all kinds of different variables that can make that happen. But we have a very, very good satisfaction rate. And again, it is a product that people keep coming back for. Now, to your point, we haven't penetrated the independent pharmacies as much as we would have liked, but the brand awareness of all of these products are through the roof. I mean, give you an idea, we're right now on our 6th year of being included on the Inc. 5000 list. And for those that don't know, the Inc. 5000 list are the 5,000 fastest growing private companies in the US. So very, very few companies, make the list, and even fewer make it a 2nd, 3rd, and now, like us, a 6th time in a row. So you definitely have a product that again sells itself, but has enough track record out there and enough success stories that you guys can build off of it.
I love it.
So, and we've got a plethora of studies, like we said. We've got medical professional letters of recommendation that we can share. We've got a ton of testimonials, like the one I've got here. Dr. Komatar is actually probably one of our biggest evangelists on our brand. He's a leading neurosurgeon, and he's been taking frog fuel, I think, for the last 8 or 9 years. We've got, social media testimonials from him that we can repurpose. But again, I think that's the biggest testament. You got, a doctor like him that's on the forefront of every kind of scientific work done with the brain in general. And he swears by our product. Same goes true with everything from amateur athletes up to professional athletes, including, Division I, NCAA, and Olympic level as well. Now, if anybody needs to, write down on the bottom there, CustomerSuccess.op2labs.com. That's a repository for all of our case studies, scientific studies, letters of recommendation, all of these supporting documents that I'm talking about. So we have.
We can put that. We'll send it out in the replay too.
Okay.
So we'll send all that out so everybody has those resources.
Great. Appreciate that.
You sold us, Eric. We want this in our pharmacies. We love it. How do we get it?
Yeah, for sure. How
do we start? Tell me how it's going to go.
Outstanding. So I'll move right along because a lot of this stuff is baked in. So What Sarah is going to do is follow up with an email that you guys can send out. Ultimately, you need to reach out to her. It's going to be basically a two-step process. We'll get you to fill out our wholesale agreement. Once we get that executed, we set your account up and we're ready to go. We have a couple of offers that I'm going to let Sarah share at the end of this. I'm
Okay.
going to kind of jump through this slide because a lot of this stuff
Sure.
I've already shared with you, as far as playing well with others, increasing basket size. But Sarah, if you want to take it over and kind of go down this clinical pricing and then how they can best engage with you, I'll kind of shut up and let you take over.
Sure, of course. In the chat box, there is a, you can copy and paste in your browser and it'll be a form and it'll come to me, basically letting me know you're interested in it. That's it as well. And it's in the chat box as well. And then that way I can contact you directly, more information, whatever you need to know, I can let you know. This is our retail pricing there on the top. That's what it sells for retail. So I always recommend my pharmacies to be a little bit under retail because that's what we sell online for, things like that. And then what we basically do with our pharmacies is we give you you order by the case. There's 6 boxes to a case, 6 bottles to a case, no minimum order, just by the case. So you don't have to stock a bunch of inventory, and you get a 33% discount from there. And I can give you like exact pricing if you're more interested, but from there you can price it whatever you want to in your pharmacy. So, but I do recommend being under why would they buy from you if they can buy from Amazon, right? That's what I tell my people, be a little bit under. There is always bulk discounts, and free shipping at certain points of time as well. If some of you had interconnected with multiple facilities or things like that, we can talk about that. And if you sign up with that form and you're interested, we get a wholesale agreement today. If there's a bunch of people, give me 24 hours to get back with everybody.
Sure.
We still will honor this special, get free shipping on your first order and a bag of the new vanilla protein to try. That was the bag that Eric showed. So, you kind of decide your pricing from there. We just sell it to you wholesale.
Yeah.
Okay.
Hey, one quick thing to add, and then I promise it's the last thing, but it really goes back to our standards and holding our partners in high esteem. We have a very, very aggressive MAP policy, which really centers around not only that advertised pricing, so everybody can hold on to their margins. It also excludes any and all third-party resellers on Amazon. So we work very, very hard to protect our brick and mortar retail partners, whether that's in the pharmacy or, any other retail. So again, you're not going to be competing against somebody that's, selling on price and price alone because they don't have any overhead and they're sitting on Amazon. So again, these prices are static across all retailers. We work very hard. We can't tell you what to sell for in your store. As you guys may know, that's against the law. All we're dictating is what you can advertise on publicly facing ads, right? So again, just our effort to protect those brick and mortar partners that we've got out there.
Very good. I love that. That's always a question from our folks is, if you're, am I dead in the water if they're sold on Amazon? I say no. You can price under, which is great that you guys have a higher price on Amazon. That helps. You're taking out resellers, which kudos to you. I absolutely love that. But use this as a way to get people in your store. Use it in your social posts. Use it to elevate your awesomeness in your community. Nobody knows about your awesomeness if you don't talk about it. And this is a great product to talk about and to showcase how awesome you are. I absolutely love this. Thank you for adding that, Eric. That's a big deal. So I've been doing these now. I think you're the maybe 4th or 5th product that we've had. And every time I get that answer, and every time I get a little I really wish they weren't on Amazon, but it's okay. So thank you for adding that part that you're actively going after it.
Yeah,
Heather, I just
absolutely.
thought to add, if I have a neighbor that is he's an avid bodybuilder. He's 63, a retired CEO, and the one product he is a staple is that frog fuel, and he just loves that stuff. And if you guys ever need a the guy can bench press like 425 pounds, like multiple times. It's amazing. I'm like, what are you doing? How are you doing this? You're 60. He looks like he's 35 years old. He was an ex-tennis pro. And I mean, he's just, he sent me pictures of all the products he uses, and the only one that, he changes up the creatines and the protein powders and stuff quite a bit, but the one thing was that frog fuel, man. He just swears by that stuff. And like I said, he's kind of a ham. If you ever need a spokesperson, he'd probably be he's bored to tears trying to working out all the time. So he'd probably be a great spokesperson for you.
Oh, great! No, that's awesome.
We have a question. Is the same protein in ProTGold and frog fuel?
It is, yes. So the frog fuel has, the power protein by frog fuel is very similar to ProTGold. ProTGold will have more arginine because that really is that wound care type product. And then the frog fuel has an ultra fuel, which is totally different. It's got the same type of collagen, but has been tweaked for that endurance type of activity. But the same base formula is found in all of our products.
Very good.
And I do want to add really quick, the collagen we use is from the hide of the cattle. We don't use the hooves or something that, could carry excess heavy metals and things like that. It's from the hide of grass-fed cattle. So it's highest quality of collagen protein.
Very good. And so before you said that you have testimonials and things like that. Do you tell me about marketing activities? Do you send out flyers? Is there things like that our pharmacists can use?
Yeah, I mean, from the ProTGold side and from the frog fuel too, we've got like procedural guides, how to mix it, what it's used for, conditions it's used for. We've got marketing materials that they can have. I can work with, if there's a hospital or clinics in your area that really send a lot of referrals, we can make coupons at these clinics. Like, let's say there's a dialysis or there's a bariatric clinic. We can make coupons for them that they can then bring into the pharmacy. That's that partnering relationship. So I do that a lot with my some of my pharmacies in Mississippi. And that's how they really obtain a lot of their patients, customers, is from the outpatient side, giving them that coupon, and even working with my dietitians inpatient to give them that coupon on their like dischargeable folder or that little information that you get when you discharge. So all sorts of ways that we can partner and push people. So if any of you pharmacists out there have relationships with hospitals, skilled nursing, rehab facilities, anything like that, we can interconnect together and then work to build a partnership around everybody to win.
I love that. We absolutely love that. Also, hint, our members, Pharmacy Badass members, we also do oh my gosh, my brain is just not working. Custom flyers. We can customize it all for you as well. Even if Sarah sends you something that's super cool and you want to put your logo on it, send it to us and we will do it. That's part of your membership. Thank you guys so much for coming on. And honestly, I am so thrilled to be partnering with you. I hope dearly that you guys join us as an exhibitor at our summit. We would absolutely love that. And I can't wait to see all of our pharmacy friends do so fantastic with this product. One thing that I do need to kind of chat about, and I'm not very good at this, so bear with me, Pharmacy Badass membership. We are starting our November cohort today. If you have been on the fence about joining, if you don't know if you want to join, hop in. Email me, Heather at DiversifyRx. I will get you squared away, linked up, hooked in. Start the cohort and see if it works. Get your team on it. Really give us a try. I know that you all will be successful. I see all of you keep joining the, this webinar and registering for the webinar. And I absolutely love that. But let's help you put some of these awesome strategies to work. So I look forward to all the fabulous emails I'm going to get about joining our cohort today. Sarah, thank you so much. I will send all this information out. So it will be a couple days that you'll still be getting trickled in new forms. Is that okay?
Yeah, absolutely. Yeah.
Okay.
Trickle it good,
right.
or send them all one time, whichever. We'll handle it. We'll manage it.
Okay. All right. Thank you guys so much. As always, send me your questions, your thoughts, what I'm doing right, what I'm doing wrong. Heather at DiversifyRx. Everybody have an awesome day. I will see you next time. Bye-bye.
Ciao.
Thank you, guys. Thank you.